Occupational health is the monitoring of the health of an employee at the workplace, preventing injuries, occupational injuries, and occupational diseases like silicosis. Silicosis is a lung disease caused by silica, which is a dust from gold. And then to prevent asbestosis, which is also a lung disease caused by asbestos, especially as asbestos employees who work with asbestos. Your employer referred you for occupational health because it's a standard, national standard, SANS, for each and every employee to know his or her employee's health before they can commence their duties, to avoid unnecessary death at work, to avoid unnecessary compensation. Because if an employer doesn't know your health and you're hypertensive, you're diabetic, and then the diabetic is high, the sugar is high, and then they put you on highs, you fall up there, down, and it's a loss. You can lose life, and then unnecessary compensation, you need to be compensated because it's injury and death on duty. So, but if your employer started by taking you for medical surveillance by occupational checkup, you can prevent that. Pre-employment and annual and exit medicals are all important to an employee and to employer. Why? Because pre-employment, that's where an employer have to know the medical surveillance and the condition of an employee that is going to employ. And after that, it needs to be a continuity of a year. That is a standard, 12 months. It's valid for 12 months. It will go on and on and on like that until the patient decides to resign. That is exit. And then exit medical is also very important to be done so that we can do what? Baseline comparison. We're going to compare the results by the end of his duties by our company with the entry test by the time he started with us. And interimly, we need to check what was happening. So it's a round figure now. We know him by the time he comes in, and then we will know him by the time he's with us. Now we know him by the time he's exiting, leaving us. We compare all those and see, is there anything wrong or right? Your employer might be allowed to see your medical records, but only the specific one. The specific one meaning that the one that the employer brought you here for us to do, the one that is suitable for kind of job you're doing for him. If actually we need hearing for your job, then we can. But if the lungs has got nothing to do with your job, with your employer, we can't release that to him. No, my dear, you won't be fired if you found unfit for duty, because the main reason for doing medical is to have all those two answers, fit or unfit. If you're fit, then happy for you, good, continue working. Now you're found unfit. What makes you unfit? We need to correct that. We're not going to take your job out of your hands. As most of you, they become tired and scary, thinking that we're going to take your job away from you. No, we protect you. If you're unfit, the reason of that is what? Is blood pressure is elevated. We stop you for a while from work, temporarily. And then when it's normal, we take you back to your work. You understand? We can never remove you from work, but we can prevent you, protect you. Each and every employee working for a certain company should do medical surveillance. And then each and every company should send all their employees to professional occupational health provider like CareNet. Occupational health fitness contains all health towards the employee that was the test that was done during medical surveillance. His fitness, his condition, about all the tests that were run over him, all the results are there. Fitness is there on the certificate. The construction regulations and Annexure 3. Annexure 3 is a document where the following has been laid down. The exposures and kind of PPE provided to the employee towards those exposures. A construction regulations is a standard to follow the rules and the plans and the hazard identification on the construction to save life of the employees and to follow the rules of the construction properly according to South African national standards is very important to comply. And it's one of the compliance by the employers. And on top of that, we need to bring up the Annexure 3. Annexure 3 mostly is working mostly on construction. We can't do away with Annexure 3, especially for the constructions. A general medical is basically an entry medical when you start. It doesn't include like working on heights, working underground. It's just mostly working on surface. Soft kind of work, not difficult jobs. A general medical is basically an entrance of a standard medical where we just do hearing test, audiometry test, spirometry test, vision test, urine test, height and weight, blood pressure, BMI. That is a combination that we can find in a general medical. A general medical can be done by any employee suitable for a general standard medical. Mostly office workers, surface workers, those can do general medical. Some of the industries that need this type of medicals is agriculturists, cleaners, securities, and office-based employees. When you get a referral letter, it means that something went wrong with one of your tests. It was abnormal, and then now we have to identify what. It might be blood pressure, it might be vision test, it might be hearing loss. It might be a lungs, after lung function test. Then we'll have to refer you to a specialist or to a clinic, municipality clinic or hospital, X-ray or something. So depending what was abnormal, when we run all your tests over you, we refer you. A referral letter will be given to you on your hand, and other will be sent to the employer so that they must expect you to be absent for a while. Anyway, the letter will be explaining for how long have you been away from work so that you can be sent to those facilities that you can get help as far as your referral is concerned. You work in confined spaces. Kind of medical you need to do. We're going to do all the tests, run all the tests that we run with a standard medical, general medical, and then with additional to a questionnaire on you, especially confined spaces. That has got a psychological questions in it. Example, are you afraid? Are you working in confined spaces? Yes or no? Are you scared to work in confined spaces? Yes or no? You know, I don't know. And then I will consider, as an occupational health nurse, I will focus more on your yes. When you say yes, you don't want to work there, that's where I'm going to act on that. I have to remove you. When you say no, yes, I remove you. Because now you already told me that you are scared. You've got reasons not wanting to work in confined spaces. And what if we force you to go there and you die in there while you already indicated? I remove you. Working at Height Medical is an additional medical to a standard medical, general medical, with the following tests: psychological test, where we ask, are you psychologically affected? Are you suicidal? Are you aggressive? And blood glucose is an additional test. Like people working on height is bricklayers, is scaffolding workers. Under working on height medical tests, it's like standard ones. We do height and weight, we do BMI, we do blood pressure, we do blood glucose, we do psychological questions like, are you suicidal? Are you aggressive? Are you short-tempered? We do audiometry test. We do a lung function test. Occupational health nurse will have to sign off, and then after signing off, forward it to occupational health doctor. Why? Because those are specialties in this faculty. We know who can be fit or unfit for what. We're the only two people who can declare someone fit here or unfit. Some job descriptions that require this medical to be done is bricklayers, electricians, technicians, boiler makers, installers. With the Working on Heights medical certificates, you can do driving. You can be a driver, you can operate a crane, you can operate heavy machinery. An operator medical is also an additional medical to the basic one, general medical. But in this case now, we're going to add blood glucose and all the tests, and we're going to add a kind of vision, differ from the other one. Here we're going to do a keystone vision, a printout. We're going to not test them on the wall. We test them into the machine, the vision, because we need to see the visual fields from them. Occupational nurse have to sign off an operator medical and send it to occupational health doctor. And then from there to the client. These are the only two specialties that can sign off the medicals. OHP and OMP have to review the medical because that is in the faculty of industrial nursing. They have to know who is fit or unfit. In terms of job placement, proper job placement for a client must work where he's supposed to work. Being healthy and psychologically and emotionally and in a safe place is only the doctor who can identify those areas for an employee, an occupational health nurse. Ergonomics medical, it differs from section to section. I'll start with the office workers, the comfort of a worker at the workplace comfortably. Ergonomic chair. What do I mean when I say ergonomic chair? I mean what kind of a chair you're sitting on for 8 hours of your work. Is your chair adjustable? Are you able to move on your chair? Is your chair suitable for your back? No backache? No arms problems? And then still lighting. How can the lighting affect you at your workplace? Your eyes. And your PC, computer, your keyboard. How can it affect you around your work? It can affect your fingers, your wrist, by working on that. That is ergonomics. And it's most especially soft tissue injuries, mostly in ergonomics. And as musculoskeletal, we need to assess your functional of your whole body bones because of that kinds of work. Ergonomic medical differ from other Annexa 3 medicals because Annexa 3 medical is mostly construction compliant, and ergonomics is mostly about comfort of a worker in his workplace. What can injure the body? Musculoskeletal, long standing, and long sitting. Ergonomic medical should be done by long sitting workers, long-standing workers, pushing and pulling workers doing that kind of work at workplace. If you have a long-term injury where you're working, you need to report. Where you need to report to occupational health nurse, and then occupational health nurse will assess your condition and severity of your injury and report it to the doctor. If it's reportable, at how many percentage is reportable, then we'll have to inform the employer with those findings about you. And then if it's reportable, then as an occupational health nurse, I have to report that from when it started up until now. What complications do you have since when it started? Is it compensatable or not? During biological monitoring, the test is more blood test to check the level of toxicity for the type of product the company is using. Example, I can say like petrol attendants, the lead will take blood for FBC, full blood count. It will reveal the level of the lead in the blood. Biological monitoring, we test the levels of maybe like a painter's ethanol in the blood levels, and that can guide us. If the level is high, how often can we do that medical? Normally medical is 12 monthly, but if the levels are high, then we need to change time frame. It can be twice a year. And then another thing, petrol attendants, if the lead is too much in the system, then occupational nurse or occupational doctor can change the time frame of medical. Instead of 12 monthly, it can be 6 monthly. X-rays are required to be done mostly after we did a lung function test. We find out the condition of the lungs. If the lungs are having problem, then that's when we send the patient to the X-ray. And then employees that work with a lot of dust, we need to check X-ray repeatedly. But it will depend on the severity of the damage of the lungs. Fumes. Patient working with fumes, employees will need to check. And then XTB patients, we need to check X-ray every 6 months. Under biological monitoring, the specific test is a urine test, blood test. For investigation, you send all those specimens to the lab, and sputum test. The times of industries required for biological monitoring as the garages for petrol, as food handlers, because we're going to do a salmonella test there with them, and TB patients we're going to do on dust working employees.